Hi folks, it's Dr. Mike back here for another blog post on our medical exercise specialist blog. And this is a question I get often. After we've had students who've gone through the MES or PRCS program, they've successfully passed the exam, and now they're out there hanging out their shingle as a medical exercise professional. They'll get a client that'll come in that may have one of these conditions, and I'll get a call and they'll say, well, Dr. Mike, how often should the client come and how long should they come? Because the client is asking them. Now, you'll become more comfortable with this as you gain more experience and as you work with more clients. But a couple things here. Before I go through these guidelines, and we're going to look at frequency, duration, and the number of sessions. Before I go through these guidelines, these are based on the client that is medically stable. That means the client has gone through the acute, subacute phases. They've gotten the appropriate physical therapy or occupational therapy or medical care or chiropractic care. They now have been referred to you, and they have a medical clearance from their physician that says they now are able to begin an exercise program. So all the medical treatment is done, therapies are all done, they're now coming to you. So based on that, our frequency and duration and number of sessions guidelines for the total hip replacement, whether it's an anterior approach or a posterior approach, is based on the idea of the client coming in twice a week for roughly 6 to 8 weeks. Now, we know with total hip replacement clients, they can have other conditions or comorbidities. They may be diabetic. They may also have osteoporosis. They may have COPD. So the other conditions are going to impact on the frequency and duration, and you may find those comorbidities slow the client down, so they may have to stay with you longer than 6 to 8 weeks. Or for some clients, they're doing extremely well. They may not need to be with you this long. So it just depends. The total knee replacement client. And the total knee replacement client, we have a greater frequency here because for these clients, we want to make sure that range of motion in the knee is maintained. That's one of the biggest factors after total knee replacement is making sure we maintain the range of motion for both flexion and extension. So for these clients, we recommend 3 times a week for 8 weeks. Again, after that 8-week period, you can now reduce the frequency. The lumbar disc herniation client. This is for the client that's sustained a lumbar disc herniation, and they have or have not had surgery. So maybe they've had a laminectomy, maybe not. Maybe they've had a fusion, maybe not. But they do have the disc herniation. Again, this is the individual that's gone through physical therapy, chiropractic care. They now have been discharged from those services, and they're coming to you for an augmentation of what they had in the therapy with regard to, or chiropractic care with regard to the exercise. So for these clients, one of the biggest things is teaching them to lift, push, pull, and carry and reinforce what the therapist or chiropractor has told them, as well as strengthening the core, spinal stabilization, strengthening the lower extremities, and again, making sure they're utilizing appropriate biomechanics. So for these clients, twice a week for 12 weeks. Again, some clients will go a little faster, some clients will go a little slower. Number 4, the rotator cuff tear. This is for the client that's had it surgically repaired or the client that just simply tears it, no surgical repair. Twice a week for 8 weeks. Again, these clients have been seen in the acute and subacute stages, which means they're medically stable now. They can come in and they can work with you. Twice a week for 6 weeks should be adequate. And at the end of that 6-week period, you reassess, make the determination if the client needs to stay at that frequency or maybe you can actually step them down. The ACL Reconstruction client. Now notice with this one, we're saying 2 to 3 times a week for 8 weeks. Biggest thing with the ACL reconstructions is they've had the surgery, and with the surgery, they go through a period of physical therapy, and we know that the insurance carrier is not going to reimburse for the amount of therapy that they need. So they're going to come out of therapy. They'll still have some atrophy. They should be medically stable in that they're able to ambulate with no problems. They should be able to probably run at that point. Maybe they've been issued a brace. Their swelling is now under control. The knee is stable enough that they're independently ambulating. And along with that, they've already started the exercise with the physical therapist or the athletic trainer. So now they're coming to you for a continuation of the program. So we're recommending 2 to 3 times a week. And we're saying here 3 times a week on this, 2 to 3 times a week on this, because we know one of the biggest issues is getting that quadricep bulk back and getting that overall leg strength back. So that's one of the keys you're going to focus on. And again, an 8-week period of time. At the end of that period, you reassess. You may want to maybe step the client down, or maybe the client does more independent exercise. The meniscal tear. Now this is one that probably is the diciest of the ones we're looking at here. Because with meniscal tears, it could be a minor meniscal tear that just requires a arthroscopy, or maybe there is no surgical procedure done, or it could be a meniscal tear that is significant and is one that has been a slow healing process that slowed down the weight bearing and the return to function for this client. So with these, as well as with this, as well as the other conditions, you've got to communicate with the doctor, therapist, or chiropractor. You should get a medical clearance. And in our medical exercise specialist and post-rehab conditioning specialist workshops, we teach protocols for all of these conditions, and with the protocols, we have clear-cut medical exercise criteria the client must meet before they come in and start to see you for an exercise program to ensure you don't work with the inappropriate client. So again, we adhere to those criteria with all of these conditions. So for this knee meniscal tear client, this client should come in, they should have minimal swelling. They may still have some swelling. They should be able to fully weight bear. They should have full range of motion. And if they don't, send them back. But if they do, they can proceed on with you if they have a medical clearance twice a week for 6 weeks. Again, this period can be reevaluated at the end of this frequency, I should say, can be reevaluated at the end of the 6-week period. Some clients will do better. Some clients will need more time. And then the hypertensive and diabetic client. Notice we have 2 to 3 times per week here, ongoing. Now with these clients, we know the hypertensive and diabetic clients, they need ongoing exercise. This is just a lifestyle change for them. So we put in 2 to 3 times a week because most clients aren't going to be able to come to you 4 days a week or even greater to a daily, but they need to do something on their own when they're not with you. So key thing here is 2 to 3 times a week, we want to make sure they become independent with the exercise. They're coming in to see you or you're going to see them at their home, but they're also doing exercise on their own when you're not there. So all of these conditions, you're giving them a home exercise program, or what we call homework. Now, one thing we've learned with homework is if you give too much homework, kids don't do it. If you give too much homework, clients don't do it. So guideline for homework is give them only 3 exercises. 3 exercises, and tell them when to do the exercise. Don't just simply say, do them twice a day. Tell them when during the day to do it. For our total hip replacement client, Mrs. Smith, I want you to do your first round of home exercises. I want you to do that after the morning news shows go off, but before your soap opera comes on at 11. And I want you to do the exercises again in the evening, right before the evening news comes on. So we tell them specifically what to do. And if you're going to add exercises, remember, we're going to stick with 3. If you're going to add exercises, so you've given them 3, and you're going to add another exercise, take an exercise away so they're only doing 3. I found over the years, working with physical therapy patients and now with medical exercise training, 3 is about the limit that you're going to get out of a client with regard to appropriately remembering the exercise, doing it appropriately and effectively. 3 is usually going to be your limit. So again, with these guidelines here, these are general guidelines. As you progress in your experience and your time as a medical exercise professional, you're going to find this may change. And it may change due to the severity of the injury or the surgery. It may change due to the client's comorbidities. Maybe they are hypertensive or diabetic, or they have COPD, or they're obese. That's going to have an impact. So these are general guidelines, but again, it's based on the idea they have a clearance from their physician, they're medically stable. We're not circumventing the medical care by saying, hey, you've had surgery a week ago, come to me, I can handle this. No, send them to the therapist, send them to the chiropractor, send them to the appropriate care, and then when they're medically stable, they come to you. One thing I need to mention, in an earlier blog post, we talked about the idea of red flags. If you see red flags with these clients, they need to be referred on to the appropriate medical professional so they can get the appropriate medical care so they become medically stable to tolerate the exercise program. So if you have questions about these guidelines or this blog post, please email me at drmike@postrehab.com. We again go over these guidelines and protocols in our medical exercise specialist and post-rehab conditioning specialist program. If you want to get more information on those programs and enrolling, please go over to medicalecexercisespecialist.com or postrehab.com. Again, thanks for watching. Best wishes building your medical exercise training practice, and please feel free to shoot me an email. I'll be glad to answer questions for you. Thanks again.